Good evening, Los Angeles. Thank you, as always, for joining us this evening for an update on COVID-19 here in Los Angeles. You know, for many in this city, these days of crisis have invited feelings of distraction, of despair, even panic. And in days like this, they can feel like one just bleeds into the next, like run-on sentences without punctuation, a comma to pause or a period to end, an exclamation point to celebrate or a question mark to ask what comes next. And it is important for all of us to take a moment to remember who we are and to mark the time as it marches forward. Tonight, for Muslim Americans in Los Angeles and Muslims around the world, it's the beginning of the holy month of Ramadan. And I want to say Ramadan Mubarak to our Muslim brothers and sisters. It's a holy month that marks when the Quran was revealed to Muhammad, but it's also a time of generosity, of reflection, a time to grow closer to God and to see the connections that knit us together. I read a column by Tom Friedman a couple days ago, the New York Times columnist, in which he interviewed Dov Seidman, a great leadership expert, who quoted from Emerson a quote that I loved: "In each pause, I hear the call." And I hope that this briefing each night is that pause in which each one of us can hear the call of this moment, the call of each other, and the call of the work that still remains ahead of us to respond, to reopen, to recover, and to reimagine here in LA. And though Angelinos won't be able to gather together, for instance, for iftar, to break the fast, or for many of us to have weddings or graduations, we know that there are pauses that help us to reflect on who we are and where we're headed. That's why I start every weeknight briefing with back to basics. It's easy for the data to blur together. Numbers can be confusing, but they tell us the story, the larger story, of how this virus has affected, is affecting, and will affect our lives moving forward. And we have to remember these aren't just idle facts. Behind every data point is a human life, a human being whose value we protect in every act of staying at home and the generosity that we see. Today, we learned one statistic that bears out that suffering, that 4.4 additional claims for unemployment benefits brought the 5-week total to 26.5 million Americans. These numbers are staggering. They're bad news, but I also have some good news to share as well. Because here in Los Angeles today, we learned the good news that our Department of Housing and Urban Development at the national level awarded the city's housing authority $35 million for our Watts Rising Transformation Plan to improve and expand public housing units at Jordan Downs. Watts in the 1960s was synonymous with unrest. For decades has waited for investment, new affordable housing, commercial spaces, restaurants. And a moment when so many of us are hurting, these federal dollars will help us assist the people of Los Angeles who live in and around the Watts community. Now, we asked for this money long before COVID-19, but we received the money separate from the crisis. But it really came at the exact right time for exactly the right place. And I want to thank Secretary Ben Carson for his partnership in ensuring that this application successfully moved forward. I congratulate my colleague, Councilmember Joe Buscaino, and Doug Guthrie and his team at the Housing Authority for the City of Los Angeles for their incredible work to get this done. Just as we embrace the good data points, we are unafraid to acknowledge those data points that show the challenge still ahead of us. So let's turn to today's numbers. Today, the county reported 1,081 new cases, bringing our total to 17,508 cases, a 7% increase since yesterday. For comparison, now the past 7 days have seen on average 976 new cases. But a reminder, the last 3 days, we've seen some backlog of cases coming forward. So we think the new cases on a daily basis are under what's been reported these last 3 or 4 days. In the city, we saw 471 new cases, and the total is now 8,022 positive COVID-19 cases. This is a 6.3% increase since yesterday. The one number that does not vary by laboratories or anything else is the number of deaths. And we learned today, tragically, of 68 more souls that we lost here in Los Angeles, and we mourn them. This brings our total fallen to 797, a 9% increase since yesterday. And another dark threshold that we crossed is that COVID-19 is now the leading cause of death in Los Angeles County, above heart disease and above emphysema. For comparison, the last 7 days we've seen an average daily increase of nearly 50 deaths, 49 to be exact. Deaths are doubling every 7 to 8 days here in Los Angeles still. Across the county in our general emergency hospitals, we continue to be very resilient and strong. And thank you to the county, thank you to each hospital that's working hard to make sure there's capacity. I visited Kaiser Hospital at Sunset, as I mentioned, I think yesterday, and heard from them the work they did just in one hospital to almost double the number of beds that could be needed should we have a surge. But our numbers right now are that there are 1,316 beds available, including 1,052 acute care beds and 264 ICU beds, those most critical ones for the sickest among us. And there's an inventory of 1,227 available ventilators. We're looking to keep folks healthy and safe, so as every public health expert makes very clear, testing is central to that task. So let me update you on that. Today marks exactly 1 month since we opened our first testing site. What started as an effort to fill a glaring gap at the national level and to initially protect our first responders quickly expanded from 1 site to 4, from 4 to 8, now to more than 30 locations across the city and county in a partnership between both the City of Los Angeles, the county, and many of our nonprofit partners and volunteers. We have the capacity now to test 12,100 people a day. And by the end of today, I'm very proud that these testing centers will have passed a threshold of testing more than 100,000 LA County residents through these test centers. And now, as I announced yesterday, you can be asymptomatic if you are a critical worker and get a test. These are our critical workers on the front lines, and let me be very specific again about what we've opened it up to, because I know we had some questions. Grocery store and pharmacy workers, folks working at hospitals, key government employees, including our bus drivers at Metro, and shelter workers and key government employees. And we hope to expand this more in coming days. Those are the essential workers, the critical workers. There are other permitted workers we know who are in office buildings or who might be doing other important work. The more tests we have, the more tests we will do. Every day we get more. I promise you we'll continue to open that aperture. But if you qualify because you have symptoms or you're one of those critical workers, get a test today at coronavirus.lacity.org/testing. One of the most tragic things about this virus is that 74% of the victims who have died in Los Angeles from COVID-19 are 65 and older. And more than 30% of all of our deaths, too, were residents of long-term care facilities. So just as we focused on the vulnerable Angelinos who are unhoused, who are experiencing homelessness, just as we focused on essential workers and vulnerable communities, we're doing the same for skilled nursing facilities and working closely with the county, and we look forward to their announcements tomorrow on some guidance for not just LA City, but the 88 cities of LA County. We're going to continue focusing on those places that can be death traps. If people have, as we've seen across the country, surges of cases, and among our most vulnerable seniors, we know that it can be devastating. Thanks to our partnership with UPS and Everywell, we will surge capacity of our mobile testing teams whenever there's an outbreak someplace from 3 to 6 teams on Monday. And thank you to everybody who's doing that work. And we will offer free monthly testing at all skilled nursing facilities for residents and workers. And we're going to be talking to the county about, in the city of LA, mandating that. More on that tomorrow. And for everybody else, we're offering same or next day appointments. So again, check out that website. If you qualify, please do yourself, your family, our city a favor and get tested. Along surging emergency shelter beds at our recreation facilities and expanding hygiene stations citywide, testing is a very important tool in our work to protect the health of Angelinos experiencing homelessness. On Monday, the Los Angeles Fire Department launched a new high-capacity testing site directly in Skid Row on the street that people can just walk up to. Located next to Gladys Park, the site offers free access to COVID-19 testing for residents who walk up or who are referred to the program by our street outreach teams that have already made health and wellness checks on thousands of Angelinos who are experiencing homelessness. Today, I can report that in just the first 3 days of operations, Testing Site has provided free tests to nearly 500 unsheltered Angelinos. This number surpasses the amount of testing conducted on Skid Row over the previous month, just in those few days. And we're doing everything possible to keep everyone at the site safe. Our LAFD personnel have the PPE that they need, guests at the testing site are physically distancing, and direct transportation to medical care is available for anyone who is presenting COVID-19 symptoms. And I'd like to thank the brave men and the women of our fire department who are helping make this happen. They've embraced this mission. You've done it with the courage that I have seen year after year as your mayor. Thank you. This testing site is just one part of our broader work to surge our street-level engagement across the city. Our police and fire departments are partnering with street outreach teams from our Homeless Services Authority and the county, including nurses, case managers, mental health professionals, and they're conducting these proactive wellness checks that I mentioned across our larger encampments in Los Angeles County, helping screen people for symptoms and bringing them indoors to those hotel and motel rooms and shelters that are available. Since we started this program on just April 14th, street teams have connected with more than 3,200 Angelinos who are experiencing homelessness and have provided direct referral and transportation for 58 that did have symptoms to either a city and or county program. Every person whose life we save, every person who we bring indoors is one more step forward in our fight against COVID-19. And we need every Angelino to join us in this work and to make sure that our brothers and sisters who are experiencing homelessness are safe. If you see someone on the street who you think could benefit from a visit from an outreach worker, please use the LA HOP outreach portal. That's la-hop.org. la-hop.org to request a visit, and our partners at the Homeless Services Authority will dispatch a specialized team to the location that you mentioned. And remember, if you encounter any individual homeless or housed who is experiencing life-threatening complications like shortness of breath, please don't wait. Get help and call 911. Thank you. We've taken consistent steps to ensure that no one is taken advantage of during this crisis, including important protections for the people of Los Angeles during an already stressful time. And yesterday, the City Council built on some of those protections, and I want to thank them here publicly. They extended the rent increase freeze to the vast majority of rental units in our city, governed by our rent stabilization ordinance, for an entire year after the end of this emergency period. When our city begins the hard work of recovery, Angelinos will need the time to get back on their feet and the resources in order to stand up again. And I'm grateful to my council colleagues, including council members Mike Bonin, David Rue, Marquise Harris-Dawson, for their leadership on this ordinance. And I look forward to signing it as soon as it comes across my desk. And today I signed into law the work of the council on an anti-price gouging measure that will prevent anyone from using this crisis to exploit Angelinos in their most difficult moments. This was something that with our city attorney, Mike Feuer, we worked very hard on. And the law says if you're buying up hand sanitizer, masks, other essential items only to resell them at a profit, you may get a fine of up to $1,000 or even face jail time. So don't hoard, and certainly make sure that you are not exploiting Angelinos by price gouging in this crisis. And I want to thank the City Council for adopting these rules quickly and unanimously. And I also want to thank City Attorney Mike Feuer and his team, who saw an urgent need to address not only this challenge, but they worked diligently, because these supplies are important for our first responders who need them, for those medical workers who need them. And when we're all able to get them what they need, we are all safer. You know, from this podium, I've always said that this crisis brings out the best spirit of generosity that exists in this city, something that I've witnessed every day as an Angelino, but something that has been raised to the next level during this crisis. The Angelino Card initiative, which provides direct financial assistance to our neighbors in need so that they can buy food and other essential supplies, is a massive undertaking to help tens of thousands of our neighbors. This type of assistance is not something we have experience with, but I said we've got to stand it up now. And Los Angeles is leading the nation in developing and deploying an initiative like this. And I have good news. I can report to you that tonight, that over just the last 2 days, 1,136 Angelino cards helping more than 3,341 individuals and families totaling more than $1.1 million, were placed in people's hands already. We're going to be doing that every day. But these are people like Iris, who applied for unemployment in mid-March, but has yet to even hear back. Samantha, who supports herself and her son and her mother, but who has seen her employment reduced to just 4 hours a week. And Ricardo, who is a breadwinner for a household of 6, but the restaurant where he worked is now closed. The original plan was to try to distribute 10,000 of these cards, but because of our next announcement, over the next several days, we will now distribute approximately 15,000 Angelino cards to help approximately 45,000 individual Angelinos in need. And this increase was made possible because of the largest donation we have received to date into the Mayor's Fund for Los Angeles, a $5 million gift from the state of Qatar through their consulate here in Los Angeles. The people of Qatar have helped out this country in other emergencies during Katrina and Harvey. This generous gift will save lives. And I'm grateful to Amir Tamim bin Hamad Al Thani, my friend, and his representative in Los Angeles, Consul General Khalid Youssef Al Sada, for this truly generous humanitarian gift to Angelino families. And it has special resonance on the beginning of Ramadan. Thank you so much. And I also want to thank all of the staff and team at Mayor's Fund, the city employees and nonprofit partners who are doing all of the paperwork and meeting with people in person to distribute these cards. And let me also thank Suffolk Construction and its CEO, John Fish, for donating and installing plexiglass barriers at each one of those 16 distribution centers to increase safety for everyone. Our global connections, our national connections, our regional connections have never been stronger. But at the global level, I also want to thank the Taipei Economic and Cultural Office in Los Angeles. And through them, we've been blessed for the gift from 2 Taiwanese American business entrepreneurs, Dr. Jackson Yang and Mr. David Sun, who contributed $1 million to the Mayor's Fund. That goes directly to families in need. Thank you both for your generosity. As a reminder, applications for the Angelino cards are closed. We know more people need help. And to enable a second round from those existing folks who we already have their names and information, so you don't have to reapply, please do donate. Each one of these donations from $1 to $5 million helps. And you can go to mayorsfundla.org/Angelino to make a donation to a family in need tonight. You know, when this crisis began, one of the first worries, if you can remember back, I know a month ago seems like a year ago, but we were worried about the food supply. Should we stock up? Would there be enough for everyone? How will our grocers handle that rush of customers? And is it even safe for folks to shop or work in our markets? I've reassured all Angelinos early on and continuously that there's no shortage of food and no need for panic. But it's also important to remember what it takes to fill those shelves and to get them into that food into your hands. Because behind any essential trip to the market, there are a lot of people, an army of workers, and we can't do enough to thank them. The farm workers who are out there plowing the fields and picking the crops, those who give us the produce that we consume every day, and who never get enough credit for feeding not only our city, but our entire nation now and year-round. The truck drivers who take our food and goods from our farms to our stock rooms, and the grocery workers who track the inventory, who stock the shelf, who staff the cash registers. And then there are the delivery services, which are much more than just an app on your phone. These are people who are working as frontline workers, getting the goods out the door and onto your table. All of these folks do their jobs with little praise or recognition. I hope one day when we're long past COVID-19, we will remember those janitors in hospitals and office buildings, those folks that work in a grocery store, people who drive a truck away from their family for days at a time. These are the folks that make this country work, and they have been a part of this response from the beginning. They deserve parking lots as well that are free of littered gloves and masks. They deserve to know they're the driving force of what we are doing. They deserve the protection of you wearing facial coverings. So I hope you will join me in thanking them when you see them. I hope you will continue to abide by the orders that we have, to stay at home, and when you do go out, to have those facial coverings, not drop your gloves in a parking lot, to make sure that we keep them doing what they need to do to keep us fed and safe. So thank you to them, to all of our medical workers, our first responders, to everybody who's out there who's stretching just a little bit further to get us through these tight days. And as always, I say, continue to stay healthy, continue to stay safe, and continue to stay at home. All love and all strength, Los Angeles. Thank you. And with that, happy to answer questions. Thank you.
And our first question comes from the line of Claudia Pashuta. Oh, I'm sorry. Our first question comes from the line of Alex Michelson from Fox 11 News. Please go ahead.
Hi, Alex.
Hi, Mayor. I want to talk for a moment about business owners, because we hear so much about government assistance, which I think a lot of people are appreciative of. We hear so much about charity, which a lot of people are appreciative too. But most people really want to get back to work.
Yes.
So can you provide us any sort of insight into your thinking of maybe the kinds of businesses that may open first, the process that we'll go through with this? I know you can't give us a specific date, but maybe help people plan, because they want some guidance on this.
That's a really important question, Alex, and I know it's what everybody's consumed with, not just those who run businesses, but any of us who work at businesses. And I want to reassure people, because it's probably pretty confusing out there. The president has a task force. The governor has a task force. We saw a motion from the county that's coming forward about a task force. And we certainly have had at the city level and among different mayors in LA County and across the state and up and down the West Coast. I've been leading conversations with them and even global mayors about how do we do this? And we're not all looking to reinvent the wheel. First concept is I think it's important for us to take these steps together. I've been so proud of LA County, as I've mentioned before, whether it's with my brother and sister mayors, people like Robert Garcia in Long Beach, together with Catherine Barger, the not only chair of the Board of Supervisors, but in unincorporated areas, she and her colleagues are essentially mayors as well, to make sure that we're marching together, because it can be really confusing. People are saying, well, wait a second, it's different right there, and across the street, the rules are different. We want to have the same approach when it comes to reopening. And we also want to, secondly, take the advice first of public health, led by Dr. Ferrer and her team. What are the places? It's not necessarily the types of industries, it's the level of safety and the infrastructure around that safety that we will have, that will mandate or inform our decisions about what opens moving forward. I've heard her say, look, we're going to have some retail stores that open up. People need to get more than just food and medicine at some point, but we have to figure out the safest way to do that. All of us want to make sure that people can get, back out one day to maybe exercising in our regional parks and things like that. But what system could we have to perhaps make sure that those don't get overwhelmed and people suddenly surge to a place and spread this disease and have spikes that overwhelm our hospitals? So there's really no area we're not looking at. I can't predict today what the very first ones will be. Some places are much more difficult. Will people sit for a longer time and they build up the vapor of speaking to one another? Public health officials say that's more challenging. Doesn't mean impossible, but in a restaurant, people are sitting there for an hour or two in a tight space. That's different than a place that's well ventilated, or a store that somebody can come into for a few minutes, do some shopping, and wait patiently until the next person is able to come in. So I want to reassure folks that we won't wait one day longer than we have to, but we also aren't going to do it one day earlier than what would endanger lives. This is about a lot of conversations they're having statewide. I'll share this with you. I was on the phone with the mayors of the 13 largest California cities. Some of them up north, for instance, they didn't have construction. That was a risk we took, but we were able to do inspections of construction sites and ensure people were safe. And we've been able to have similar bending of the curve, even while allowing construction. So I think we're inspiring them to potentially do the same thing. Vice versa, other places, people are looking at those spaces. Can golf courses be safely reopened? Can tennis be safely reopened? We're not going to have group sports together. We're not going to have tight spaces. But that is what guides us. And the last thing I'll say is this will be an open process and it will be a collaborative process. I don't think government has all the answers to these things. I think that industries that care deeply about their people will make proposals to us. We need to run those by Dr. Ferrer. We need to run those by supervisors. We need to run those by mayors and council members. And I think make those decisions. But I certainly do hope that in the next, let's say, 2 to 6 weeks, we'll take some of our first baby steps forward and assess them. And the second thing I want everybody out there to hear is we're going to have to be very flexible. If we do something and it seems right, but 2 or 3 weeks later we have the beginning of a spike, we're going to have to back off of that very quickly before it becomes something worse. But if something doesn't produce that, maybe we can take a second step forward. So it's going to require patience. There are going to be times of the year when, just like the flu season, we'll see more cases and we're going to have to probably go back indoors. But whether it's people who run schools, public spaces, businesses, offices, stores, recreational spaces, we will be setting up those entities. And we're already talking to industry leaders or professionals in childcare and others to give advice. And I'll be announcing more about that process this coming week, but there's nothing more secret than what I said. We are having those conversations. We're making sure we do that together. And I do think that we will be able to, not in the too distant future, be able to get out and do a few more things, but it won't be one day when suddenly the gates are up, we'll say successful, because 96% of us, according to the USC study, still could get COVID-19. So we have to do this carefully.
Follow-up,
sure.
If you can still hear me, Mayor.
Yes.
Last night I talked with the University of Washington modeler who suggested May 17th would be a safe time to start opening up California. That is close to the date that the county originally put in. Is that the sort of timing that you're looking at as well?
Yes, today, with the caveat I always say that tomorrow that could change. Next week it could change. We do snapshots towards the future of each day based on the cases. As we've seen, we have many more deaths every single day this past week than we had the previous week. Those numbers don't help, but we also have this continuous slowing down. We don't have, except for a couple of these corrections with old tests coming in, we haven't had double-digit increases in the number of cases for a long time, but the cases still continue to go up. That could be a reasonable time frame. That's the snapshot today, but keep asking me, because in a week from now, 2 weeks from now, I'll give you an honest answer of where we think we are as well. Thanks, Alex. Next question, please.
Our next question comes from the line of Steve Gregory from KFI News. Please
Hey,
go
Steve.
ahead.
Hey, Mayor. Good evening.
Good evening.
A couple things real quick. I wondered if you had any comment. I had asked you the question the other night about storage sheds being part of your safer at home order in the eviction order and whatnot. And I see that Councilman Rio has introduced that motion. I'm wondering if you support that motion to add storage sheds and storage facilities into the protections from evictions. Also, have you been briefed at all on the temporary nursing home facility in downtown Los Angeles that's being manned by medical crew from the Mercy ship? Thank you.
I have not been briefed by them, but I do know that they're active. I actually talked with the Secretary of Defense today. I think it's here and other places where they're sending the medical personnel instead of waiting for folks to come to the ship when we do have capacity. I think it's great that our Navy doctors and nurses and medical technicians are actually going proactively and helping serve in the cities where we need it. It's really wonderful. I didn't know about that specific one, but we talked about that they're already here in the Southland, helping, I believe, not just in LA County, but looking in Orange County and other places. And as a Navy guy, it makes me very doubly proud to know that. In terms of storage sheds, absolutely, I'm open to that. I'm going to look at the details of the motion, but it's something that I'm absolutely open to. People should not have the stress of losing not just their housing, but everything that they own right now. I'd like to sit down and hear what the proposal is, but anything we can do to help people right now not have more stress, not look at more economic loss. This is really important, not just for today, though, too, it's for our recovery. If folks get out of this finally one day and we begin to open things up, or then finally get to a place where the vaccine and completely open up. If they have nothing, no job, their possessions are gone, that's going to be something that is going to hold us back for years to come. So I think it makes a lot of sound sense. I appreciate the council member for introducing that. I'll look at the details, but absolutely I'm open to that. Thank you. Next question.
Our next question comes from the line of Elizabeth Chow from LA Daily News. Please
Hey, Liz.
go ahead.
How you doing? Liz, can you hear me?
Yeah, sorry, I had to mute something.
Oh, no worries.
Okay, so I was listening to you talk about the mobile testing sites for the nursing homes. I actually just wanted to get some clarification. Are the mobile testing sites just for the nursing homes that are going from 3 to 16, I think you said? And
No.
Are there any one of those mobile testing units used for homeless shelters?
So no. So they're not mobile testing sites. They're mobile testing teams that we've been describing, I think, for the last couple weeks that roll out. I think the first one was at the Jewish Home of the Aging. We went to the Motion Picture Home. But any place where folks say, we believe we have an outbreak or we believe we have a case, we're able to roll out, usually that day or the next day latest, with tests from Everlywell and UPS, We can train people. Usually they have personnel, so we train them. We can pick them up at the end of the day for free. Where they don't have folks, we can administer some of the tests as well. And we're moving from 3 of those teams to 6 of those teams. Those are independent from what we're doing out on the streets. Streets are setting up mobile testing sites like the one that we talked about in Skid Row. We're also working with hospitals and clinics that already have mobile teams and static teams in their nonprofits that people who are experiencing homelessness trust. They know those doctors, they go to them for their health care already, and we've given them kits as well. Combined between Skid Row and there, we're well north of 1,000 kits that have been done for folks that are out there. But those are 2 distinct streams, for seniors and for people experiencing homelessness. So on Monday, these teams will go from 3 to 6.
Thank you.
Thanks, Liz. Next question.
Our last question in English comes from the line of Leslie Moran from KCAL CBS. Please
Hey,
go
Leslie,
ahead.
how you doing?
Hi, Mayor. So we just got a confirmed report that one of the people, the homeless people that was staying at one of the hotels who tested positive for COVID, left and did not want to return. LAPD has told us they cannot have that person, make that person stay. So what is the city doing to make sure these people that have tested positive for COVID and are staying in these hotels actually do stay? And if you can't, how do you really stop the spread among the homeless population?
Sure, and I don't know if there's other cases, but that may be one case. I think the great success is that we have hundreds of people who are staying at home. We may have people who are not homeless who are not staying at home too. We can never safeguard 100% of that. And somebody who's experiencing homelessness is no different than somebody who's housed. I would very strongly tell people not to do that. We don't have, a police force of tens of thousands of people going around and mandating that somebody who was positive, who left their house and decided not to stay, is back in there. But it's very dangerous if they do. Vice versa, the same thing with somebody experiencing homelessness who has temporary housing in a hotel or motel. So what we do is we try to track those cases. We try to figure out who worked folks in there and where they usually go, working with their case managers, homeless outreach teams. I don't know the details. I don't know if they're at the tail end. I don't know if it was at the beginning end. But we will always have some cases like that. And I want to remind people that's not just among people experiencing homelessness, but some people who are housed. But our strict direction maintains that we should quarantine people who have been exposed, and people who are positive need to stay put. That is the direction of LA County. And that is something that will help the spread of this continue to go down. Most people do stay overwhelmingly, and that's due to the staff at hotels. I think people out there understand that there are some people experiencing homelessness that can be very challenging in terms of the mental health issues they have and or addiction problems that they have. We know that long before COVID-19, so you can never bat 1,000, but I'm really proud of how successful it has been to keep most people there. It's much safer than everybody being out there on the street. So anything above 0 is an improvement, but we're much closer to batting 1,000 than 0. Thank you. Next question.
And our first question in Spanish comes from the line of Victor Cordero from Australia TV. Please go ahead.
Hola, Victor.
Mayor, how are you? Buenas
Good.
tardes.
Buenas
Perdón,
tardes.
creo que lo tenía en mute. ¿Me escucha bien?
Sí, I can hear you.
Okay. So, gracias. Alcalde, I'm going to ask my question in English and then I'll try to do it in Spanish really quick. Thank you very much to you and the city, the whole city for doing what you do. There's a lot of confusion on the Angelino Card. I was just browsing on the internet and it says that regardless of the immigration status, people can get helped. We've been getting a lot of messages in our webpage to our station, Channel 62, with people concerned that either the website to help them is not working, which is understandable because of the amount of people trying to get help, or they say that they just do not qualify. Could you be a little more specific?
Sure.
Once again, I know you did it once, but I want to see if I can be a little more specific to
Absolutely.
see who qualifies and when can they get the help if they qualify?
Sure. So the website is closed. We announced every single day, the day before, the 3 days of, Tuesday, Wednesday, and Thursday last week when that was open. So it's closed now. We had more applications than numbers of cards. Everybody should have been notified whether they won one of the cards. If they didn't, they are not getting one of the cards at this round. But as I also say each night, you don't have to reapply. And when we get more money, we'll randomly select people again and have more people. I'm very proud, something that we thought maybe would help a few thousand folks. We're looking now at about 45,000 people just with the money we've raised so far, which goes a long, long way for families across Los Angeles. It doesn't matter your immigration status. It doesn't matter your age. You have to qualify in terms of the income, but I want to be really clear. If people looking what do I have to do to qualify, there's no application that is open right now. If we do get enough money to fulfill not only the people who have been selected now, but all those who are waiting one day, sure, maybe it will be reopened, but I want to be clear that that is closed right now. We're going through the process of sitting down with each of these folks, interviewing them quickly, giving them a card, making sure they meet the basic legal requirements, but you do not have to have documents, you do not have to be a citizen. You can, of course, be, but those are the requirements. So en español también, no hay más aplicaciones por la tarjeta Angelina, fue en la semana pasada, y es importante recordar si tú no recibiste la notificación que tú pueden tener una de estas tarjetas, nosotros tenemos su información. Y cuando tenemos más dinero, más recursos, nosotros podemos tomar estos nombres y dar más tarjetas a más gente. Pero no hay una aplicación que está abierta ahora. Tuvimos más de 186,000 aplicaciones por 10,000 tarjetas. Gracias a nuevas donaciones, tenemos 15,000 tarjetas y cada día, cada mes, cada semana que nosotros tendremos más donaciones, más personas pueden recibir de esta lista original. Gracias. Next question.
And our last question comes from the line of Gabriel Huerta from Telemundo. Please go ahead.
Gabriel, how are you?
Fine, thank you, Mayor Garcetti. Dr. Ferrer said today that COVID-19 is now the first cause of death in LA County. La doctora Ferrer dijo hoy que el COVID-19 es ya la primera causa de muerte en el condado. ¿Qué nos puede decir sobre esta preocupante estadística, alcalde?
Bueno, esta información que COVID-19 ahora es la primera causa de mortalidad en Los Ángeles. Estas no son buenas noticias, pero también el rato de la infección es menos ahora de en las semanas pasadas. So hay una mezcla de noticias, pero esta información nos da el poder para quedarse en casa. Este es más peligroso de enfermedades de nuestros corazones, de enfisema y otros malarios. Y es importante recordar que con buenas noticias de los números, una reducción del rato de contagión, al mismo tiempo tenemos más y más casos cada día. También espero que con esta información nosotros no solamente pueden quedarse en casa, pero es importante también a tener acciones a apoyar, ayudar la gente que están trabajando en Los Ángeles. Y espero que en estas próximas semanas nosotros podemos tener pasos pequeños a reabrir partes de nuestra sociedad y a proteger nuestra gente al mismo tiempo. Pero es una notificación muy triste. Este es el matador número 1 ahora en el condado. Gracias. With this, let me turn to the Spanish portion of tonight. I want to thank everybody again. I wish again Ramadan Mubarak to our Muslim brothers and sisters, and wish you all that this pause is a moment in our life when we can each hear the call. Muy buenas tardes, Los Ángeles, y gracias por venir a la alcaldía cada noche por este momento a pausar en nuestras vidas, a escuchar la información que necesitamos y tomar acciones a salvar las vidas de nuestros hermanos y hermanas en Los Ángeles. Esta noche empieza el mes sagrado de Ramadán para nuestros hermanos y hermanas musulmanes. tiempo de reflexión para nuestra comunidad musulmana y sobre un futuro en el mundo que es más seguro y más sano, más generoso y más justo. La información, los datos de hoy. Hoy supimos que 4.4 millones de personas sometieron solicitudes para desempleo. Este es muy triste. En total hay 26.5 millones de estadounidenses sin empleo. Sin embargo, hoy el Departamento de Vivienda y Desarrollo Urbano le otorgó 35 millones de dólares a Los Ángeles para apoyar una transformación en el sur de Los Ángeles, específicamente en el vecindario de Watts. Una buena noticia para nuestra comunidad. También hoy hubieron 1,081 nuevos casos en el condado de Los Ángeles, llegando a un total de 17,508 casos. En la ciudad tuvimos 471 nuevos casos, llegando a un total de 8,022. Y trágicamente, hoy fallecieron 68 personas más en el condado, llegando a un total de 797. Las muertes en Los Ángeles están redoblando cada 7 a 8 días. En nuestros hospitales tenemos 1,316 camas disponibles. Entre ellas, 264 están en las unidades de cuidados intensivos y tenemos 1,227 respiradores. Hace un mes abrimos nuestro primer sitio de pruebas público. Hoy tenemos más de 30 sitios de pruebas en la ciudad y el condado y tenemos capacidad de hacer pruebas para 12,100 personas al día. Y al final del día hoy nos acercamos a lograr pruebas para 100,000 personas en estos sitios. Gracias a todos los trabajadores, los bomberos, los voluntarios que son parte integral de estos sitios. Las pruebas de detección están disponibles para los trabajadores esenciales. Deben contactar a sus patrones para saber cómo obtener prioridad para hacer la prueba. Personas en nuestros mercados, supermercados, farmacias, nuestros hospitales, los bomberos, oficiales de policía y otros trabajadores de gobierno críticos. El público puede hacer, y estas personas sin síntomas, estas pruebas son disponibles. El público puede hacer una cita para una prueba en la página coronavirus.lcity.org/testing. Cualquier persona con síntomas y estos trabajadores críticos sin síntomas y con síntomas. Además, el sitio de pruebas de Skid Row ha hecho pruebas a 468 angelinos sin hogar en esta semana. Nuestros departamentos de policía y bomberos están colaborando con los equipos de alcance en las calles de Lhasa y el condado para hacer checos de bienestar en los campamentos más grandes y alojarlos. Desde que este programa inició, los equipos de alcance en las calles han conectado con más de 3,200 angelinos sin hogar y han referido y transportado a 58 residentes a un programa de la ciudad o el condado. Si ve a alguien en las calles que podría beneficiarse de una visita de un trabajador de alcance, por favor, use el portal la-hop.org para pedir una visita. Y gracias a estos trabajadores por su esperanza a nuestros hermanos y hermanas en las calles. Hemos tomado pasos para asegurar que nadie se aproveche de la gente durante esta crisis. Y ayer el Consejo Municipal hizo esas protecciones aún más fuertes al extender su vida de la renta en unidades estabilizadas por un año completo después de que acabe esta emergencia. Y hoy firmé otra medida que dice que si está comprando desinfectante para manos, máscaras u otros suministros esenciales solo para revenderlos con una ganancia, puede recibir una multa de $1,000 o incluso pasar tiempo en la cárcel. Gracias al fiscal municipal, al Consejo Municipal, por su trabajo en estas medidas. La tarjeta Angelina es una iniciativa muy importante para ayudar a decenas de miles de nuestros vecinos con apoyo financiero en efectivo. Las aplicaciones están cerradas, pero hay miles de familias cada día que recibirá estas tarjetas. Y durante los últimos 2 días se han distribuido 1,136 tarjetas Angelino con un total de $1.1 millones para dar asistencia a más de 3,341 individuos en esos hogares. Originalmente pensamos dar tarjetas Angelino a 10,000 hogares, pero ahora podemos distribuir a 15,000 hogares debido a una donación de asistencia humanitaria del Estado de Qatar de $5 millones para ayudar a 45,000 personas en Los Ángeles en los próximos días. Gracias a todos quienes han sido generosos durante esta crisis. Si pueden donar al Mayor's Fund, cada $1 es importante a una familia en Los Ángeles. Por favor, visite la página mayorsfundla.org/Angelino. Esta noche también quisiera tomar un momento para agradecer a nuestros trabajadores agricultores quienes están cosechando nuestros alimentos y asegurando que tengamos los productos para alimentarnos todos los días, mientras ellos se arriesgan su propia salud. Y los camioneros y los trabajadores de supermercados que llenan los estantes y los servicios de entrega a casa. Estas son las personas que llevan los productos hacia sus mesas. Y todos ellos se merecen nuestra gratitud y la protección de coberturas faciales y otro equipo de protección. Merecen saber que son nuestra fuerza y que son esenciales para superar esto juntos. Por favor, únase conmigo para agradecerles y hacer su parte para nuestra ciudad. Quédense en buena salud, quédense protegidos y quédense en casa. Gracias, Los Ángeles. Mucha fuerza y mucho amor. Hasta mañana. See everybody tomorrow.
He said he had a zipper on his chest now. He had a full set of teeth. He was eating square meals. When he went to get his benefits,